again, you want to confirm what the diagnosis is first.
Consider post-traumatic.
That's after like after trauma, like if we talked about head injury or whiplash, something like that. So, neurological disorders, again, you want to see a neurologist. So migraine-associated dizziness, vertebro-basilar insufficiency, which is when the arteries in the neck, can get occluded. Demyelinating diseases such as like MS and central nervous system lesions. These are all something, again, outside of my scope, that you need to see a neurologist for. Other entities include anxiety. Sometimes anxiety can cause vertigo. Cervicogenic vertigo, which is related to the neck, and I've treated a number of patients for it, and the neck actually is related to the dizziness. Medication side effects. There's many side effects of meds that cause dizziness. And of course, the interaction also between medications can also cause dizziness. So again, that's something you need to speak to probably your primary care doctor about, and it's something that should be addressed. Finally, postural hypotension, which is low blood pressure, happens quite a bit when people are lying down, they sit up, they get lightheaded. It could be BPPV, but it also could be this low blood pressure. So what we do a lot of times, we check blood pressure lying down, and we check blood pressure sitting up. We see that if there's a change. So let's talk about Meniere's disease. What is Meniere's disease? Basically, it's the decreased absorption of endolymph, and there's increased pressure in the canals. There is hearing loss. So the ENT will do testing of your hearing. If they find hearing loss, that's another factor to help you confirm that diagnosis. Finally, again, the vertigo lasts minutes to hours, and you can have ringing in the ears. You can have fullness in the ears. You can have a normal physical with some loss of vestibular or inner ear function. So the treatment involves diet changes, such as a low-sodium diet, stopping caffeine, diuretic Dialox, and sometimes surgery. Also, like I said, vestibular rehabilitation is a component of the treatment. Okay, let's talk about labyrinthitis. It's inflammation in the labyrinth, or the vestibular nerve 7. It's due to a viral infection. So remember we said the labyrinth is that structure in your inner ear. That whole picture is the labyrinth. The vertigo can last up to weeks. There's testing that they do. I know they do it in JFK where they do, it's called caloric chair testing. I don't know if some of you have had it, where they put water, hot water, cold water in your inner ear. That can reveal one-sided weakness. So the treatment for this, again, vestibular exercises, time, medications, benzodiazepines, Antivert. But again, this is something I would refer, if I suspect you have this, I'm going to send you to your ENT or to get that type of testing. So what is vestibular rehabilitation therapy? It's an exercise program that's designed to promote central nervous system compensation or the inner ear deficits. So it can help with all the conditions we discussed. The goal is to retrain the brain to recognize and process signals from the vestibular system in coordination with your vision and your proprioception or your balance. It often involves desensitizing the balance system to movements that provoke symptoms. So we do a lot of head movements with eye movements. You would put a dot on the wall, we have you turn your head. So there's a lot of different exercises that we do that are part of that. So we're almost done here, and then I'll take questions. Other things that contribute to balance. Let's just review: the visual system, the sensory system, the vestibular system. We talked about medications. Greater than 4 medications, there's an increased likelihood of falling. So again, review that with your doctor. Orthopedic problems such as joint pain, back pain, will lead to muscle inhibition. So I have a lot of patients that's the case. They have knee pain, the knee kind of, the knee gives way on them, and that can cause a fall. So orthopedic issues, definitely affect balance, no doubt. And finally, environmental contributors. So a lot of times as PTs, what we do is we do a home assessment. We look at lighting, we look for throw rugs, we look for any other hazards that may lead somebody to fall. So all these things are important. And I'm probably not even there's other things that are involved, but those are the main factors. So what are treatments to improve your balance? Some of you are here because you may have vertigo or have vertigo. Some people may be here just because you saw something that said balance. And how do I improve my balance? Well, I think number one, again, it's very complicated. You need to understand, and you need to get evaluated for why you have poor balance. And we have to do these tests to figure it out. And once we figure out the reasons, let's say if you have poor sensory in your feet, I may not be able to fix that, but we have to have you compensate with the other systems. So we do balance exercises. We alter your basic support. We use eyes open and eyes closed. We work on the inner ear system. The vestibular rehabilitation exercises we do with head movements and eye movements. Yoga and Tai Chi. So all these things are proven. They have a proven efficacy to help your balance. So I'm definitely, if a patient asks me, should I do Tai Chi? Absolutely, it's a great treatment. Definitely do it. There are controlled slow movements that focus on stability and trunk control. And finally, reviewing your meds and having a home evaluation. That's globally. Those are the treatments for, again, for balance. So basically, at this point, I will entertain questions from you guys. I appreciate you coming here and for dealing with my ineptitude for the slideshow. And I'd be happy to answer questions now. If you need to email me or call me, I'm happy to do that as well. So why don't we take some questions, and we have some refreshments in the back there. Let's start in the back there.
Is this hereditary?
I haven't found anything that says it is, but is it hereditary? So does it, is it something that people within the families have? Again, I haven't read anything that says that, but it may. There may be. I just haven't read much about that.
How long might those eye movement, dot on the wall types of exercises take to work? Very variable?
Well, it depends on what your diagnosis is. Again, if it's BPPV and you haven't had an Epley maneuver and you're trying to do vestibular exercise, yeah, it's definitely variable. There's no definite answer for that. But I think it's important to understand, again, what is your diagnosis, and then I could probably better tell you how you're going to respond to those vestibular exercises. Because number one treatment for BPPV is the Epley.
Yeah.
So
no, in this case, it's not
okay.
that.
Okay. But yeah, it's definitely a big component for a lot of these other vestibular conditions.
Can an MRI indicate any of these problems?
I would say yes, they can. They can definitely pick up, central nervous system lesions, demyelinating problems. In terms of BPPV, no. This is not something that shows up.
The orientation of the crystals.
No, it's kind of, it occurs on like a microscopic level. So it's more clinical, clinical exam, clinical diagnosis, and treatment that will tell somebody. But it is important that, if it's not resolving with an Epley, and you're still dizzy and it's lasting long, many doctors and neurologists, again, it's not something I would do, but they prescribe an MRI. What's going on? Other questions?
Allergies contribute to the symptoms last hours.
I'm sorry, one more time?
Allergies.
Allergies.
The symptoms last for hours, not a minute.
Again, I haven't read much about that, allergies affecting it. Again, for something that lasts hours, we gotta say, well, why are you dizzy? It doesn't sound like it's BPPV. If it's hours, is it possibly, labyrinthitis? Is it possibly Meniere's? Those things I haven't read about being related to allergies, but then, and then again, sometimes people just say, I do get it seasonally. So I have heard that, but I haven't read much about that, so it's a good question. We'll just go. Yes?
I have two questions.
Yes.
I don't seem to be that dizzy just looking around, but once I try to turn around.
Yes.
So I've had to give up Tai Chi
Okay.
because there are movements like that.
Yep.
Now, I've had a PhD.
Okay.
Do you have an idea about that? And my other thing is that I'm off balance because
this is a perfect example of why orthopedic problems contribute to balance.
And I am so unbalanced